A 6-year-old boy is brought to the physician. Cardiac examination shows normal S1 but a split S2. Pansystolic murmur is there, and when the catheterization is being done, the oxygen level in the right side of the heart, right chambers of the heart, is higher than the left chambers of the heart. So that means the good blood of the left ventricle is passing into the bad blood, deoxygenated blood on the right ventricle and making the right ventricular blood to get increased oxygen levels. That means there's a left to right shunt when you have done the cardiac catheterization. So that is a case of ventricular septal defect. Unless Eisenmenger complex develops, where left to right become right to left and cyanosis develops, until then the left to right shunt of VSD will cause more amount of oxygenation of the right sided blood is what you have to basically remember. So this is a typical cath data. Whenever you see a left to right shunt where the right ventricle having 85.1% of oxygenation is well above the normal value, that is increased oxygenation is what you need to remember. 32-year-old, abdominal examination shows tender palpable mass. There is an ovarian vein thrombosis. So you should know gonadal veins, how do they drain, how do they differently drain on the right side versus left side. So typically on the right side, the ovarian vein, or in the case of the men, the testicular veins drain directly into the IVC. Whereas on the left side, they drain into the renal vein. That's what you have to basically remember. Now there is a study of the bladder function. A man drinks about 1 liter of water and there is a delay of urination for about 30 minutes. Which muscle will help in voluntary control of micturition? So if you look at the act of micturition, there are many things involved. The detrusor muscle is a smooth muscle, that is an involuntary muscle. Parasympathetic innervation will make detrusor contract. Parasympathetic blockade will make the detrusor become relaxed. That's the reason always remember, if you happen to give an atropine injection to somebody, atropine is anticholinergic. Acetylcholine supplies the detrusor and make detrusor contract. If you antagonize acetylcholine, the detrusor become relaxed and the bladder become retained. Bladder retention will occur if you give atropine. That's the reason before you give atropine in a OP poisoning, don't forget to pass the Foley catheter. After passing Foley catheter, then you make atropine injection. Then the relaxed bladder will be able to drain into the Foley. Then there is the internal urethral sphincter, which is a smooth muscle. Then external urethral sphincter is a skeletal muscle, and it is the voluntary control is through the skeletal muscle. So that's the reason it is the external urethral sphincter, which is the skeletal muscle, is the one which voluntarily makes the urine to get drained, is what you need to remember. In order to know the rate of DNA synthesis, what labeling do you do to the DNA? Thymidine labeling is the one which is basically done. A 2-year-old boy, genetic analysis shows that there is a mutation of the GAG codon to GUG codon. So what is the anticodon of the GUG? Obviously CAC become the anticodon. So this is how DNA, mRNA will have the code. There is an anticodon loop that binds to the mRNA. Then the tRNA will have a amino acid which gets attached, is what you have to basically remember.